All right, y'all, we are live. Welcome to the Stronger Life Podcast, Fitness for 55 Plus. Woo! Dr. Jeff Musgrave in the house.
Yes. Dr. Dustin Jones in the house.
Doctors of Physical Therapy. So we are going to be tackling our member questions inside the Fitness for 55 Plus Facebook group. And we've gotten tons of questions. One in particular that we want to hit on today is from Sue Ezra. And Sue, how are we doing? Sue said, I'm going to be non-weight bearing for an extended period of time. What can I do to prepare for this? How can I maintain my strength and not lose all that I have gained by going to Stronger Life? So Sue, for context, is a current Stronger Life member. She is non-weight bearing, meaning she had a surgery on her foot, so she can't bear weight or put weight on that for a period of time as that heals up. And she's wondering, what can I do to prepare for this, and how can I maintain my strength and not lose all that I have gained? So, where would you start there? Let's start with the prepare piece. So you're going into a surgery, and we could say, surgery like Sue had, we could say, some type of whatever joint area that we're talking about. How would you prepare going into something where you know you're going to be laid up for a while?
Yeah, I think probably the biggest system we can impact is leading up to surgery is just getting as strong and fit as possible. All the research that I've seen looking at, they call it prehab, where people will actually go to do physical therapy visits to get strong and work on their mobility prior to surgery just to make their surgery outcomes better. So the first key is staying as active as possible leading up to surgery, because the healthier the body is, the faster that recovery is going to be. So working on strength training, working on building your cardiovascular system, working on your mobility, because we know there could be a period of time where some of those joints and muscles aren't going to get the normal activity level they've been getting. But all that blood flow, all that strength is just going to make the recovery process so much faster. So I'd say get as strong and fit as possible leading up to surgery.
Yeah. And Sue asked this question. She's had her surgery since this question, and she did just that.
Yes.
Hit the gym hard and just got as fit as possible, and it's paying off for currently at the moment. And we've had several members at Stronger Life where this has been the case, whether it was a knee replacement, fixing some type of orthopedic issue, where folks have gotten after it ahead of time, and they're back at it in no time. Ann Shaw is one that comes to mind. So she shares this publicly, but she had a knee replacement, and what was it, back in class within how many weeks?
I'm not sure on that. I know she was hiking in 3 months.
Yeah, hiking in 3 months.
Not like a cane or walking sticks, just out on a hike.
And we're talking, I think it was in the Red River Gorge in Kentucky. We're recording this during the winter, and leaves are down the ground, super slippery. You can't see the roots and raw, like super dicey situation, and she's out there crushing it. But yeah, I think she was back to class at kind of that 8-week mark, and then just went on a hike at the 3-month mark. Don't quote me on that, but it was impressive. We see that a lot with folks. So preparing, that's one, get as fit as possible. So let's say you're laid up. It may be a surgery like Sue where you're non-weight bearing, or there's a particular area where you need to protect it a little bit or work around it. And this kind of goes into our last episode where we talked about there's hardly ever a time to just stop, right? Like the bad pain and how there's a lot we can do. So how do we go about that to maintain strength and not lose what we've gained when we have a limitation that we do have to respect in some way, shape, or form?
Yeah, I mean, I think just knowing the realities of the precautions immediately after surgery and just setting yourself up for success in the home. Like if you're not going to be able to go to a gym or to somewhere that's going to be able to accommodate, what am I going to do for cardio at home? Is it going to be on the roller scooter on my knee, making laps around the room for cardio? Is there anything off limits with any of the other body parts? Can I still get sweaty and push my heart rate and build my strength?
That's a big one.
What easy things can I do? Resistance bands, dumbbells. Okay, I can't stand up and do these? Can I sit and do them? Can I still push, pull overhead? Nothing's off limits on this other leg, so I want to be bending and straightening my knee under resistance, or working on coming up to stand and back down on the side that is good. And really just things are going to challenge maintaining as much strength as possible in anything that's not off limits. And then also getting that cardiovascular response. Because just like we talked about in the last episode, that nutrients, the superhighways, our cardiovascular system. And we now especially need blood flow to help expedite the recovery process. Nothing's going to take care of that swelling better than our own body's system. Not that we may not need to ice or do other things that are, recommended by medical professionals surrounding that procedure, but just getting blood flow to the area, and working on our nutrition and getting our heart rate up, all those things are going to expedite our recovery. But that old adage of just lay around and rest till it feels better, they found out the longer you lay around and rest, the longer it takes to recover, which sounds really counterintuitive. It can sound really scary, but that's what the research says. And they're trying to keep people out of the hospital and out of these situations where people are doing as much as possible, which, if you're thinking about for yourself or a loved one, you're going to want to try to help and do as much as possible. But really, the fastest way for them to recover is to be able to do as much as they can safely, including exercise, let alone getting yourself dressed and getting up and moving and being up on your feet. Yeah. But you could find yourself, there's so many times I have treated patients as a physical therapist that went to have a surgery and came out with orthopedic issues completely unrelated because they were laying on the couch or they were sleeping in a chair and they weren't moving, and all these different aches and pains showed up because their body wasn't getting the movement. Oftentimes, not all the time, but oftentimes in those scenarios, if those people had had a better exercise plan in the interim while they were recovering, those injuries would have never happened.
Yeah.
But it's like I was treating them for a surgical knee and an achy back or some type of back pain issue because they'd been sleeping in a recliner and they weren't up and moving. And once they got back to moving and got their strength back, all those extra issues went away.
Yeah.
And it only leads me to think if they had been doing that the whole time, that injury would have never surfaced.
Yeah.
Just a missed opportunity.
I think the interesting thing, too, that you alluded to is that I think it definitely makes sense to all of us that you can maintain the fitness and health of all the other parts of your body when you're protecting that foot or shoulder or whatever. But the big thing that you mentioned, I think this is not a necessarily common thought, is the benefit that injured area gets when you work out other parts of the body. Like just that systemic response that we get from exercise with the blood flow and all the stuff that you mentioned. Like, it is good for my foot when I work my upper body.
Yes.
That's hard to comprehend, but we get those big benefits, and Sue's doing that right now, which is cool to see. So let's say there is a limitation or an injury where you can still easily get out of the home and can go to the gym. What does it look like for someone to come to Stronger Life that's like, hey, I got to really work around my right shoulder? How would they still be able to participate and maintain their fitness in the presence of something like that?
Yeah, I think the biggest thing is just having good clarity on what is allowed and what is not allowed, particularly with surgery, or we have lots of people that they've got old injuries or issues that crop up with shoulders. So we need to know some idea of what's causing the pain, like what's off limits. And then it's really easy so many times to either just reduce the amount of weight, reduce the range of motion, like only go through part of the range of motion, or just switch the movement. It's so common that people have shoulder injuries here where maybe they're stiff and it's painful when they go overhead. So if we reduce the load and that's not better, we can't reduce the range of motion and it's better, then we just switch the movement. So they're very similar benefits to just pressing forward. So someone who maybe would have been doing some type of like pressing movement overhead with a dumbbell or a resistance band, we can simply have them press this way and work very similar muscle groups without irritating the injury or the surgical site. There's so many times that we can work similar muscle groups or even the same muscle groups in a different position with no pain without making the injury worse. But a lot of times it's easier to just say, and we've seen this in the medical community, and not everyone does this, but they'll say, just no exercise.
Yeah.
It's a lot simpler to just say no, don't do anything, than it is to define what is allowed and what's not allowed. But oftentimes, there's quite a bit of space in there to do quite a bit that'll actually expedite recovery. Sorry, I went on a tangent there.
No, it's so true. And I think for folks that aren't familiar with the Stronger Life class, like Jeff does all of our programming and he equips all the coaches to handle that scenario. Like we all have several options for each thing that we do, to where if you've got the achy knee, shoulder, whatever, like we can work around that and you're still going to get a good workout. And that's something that is just so valuable for folks, and I think, we're talking a lot about aches and pains and injuries, and it's not to say that, that we cause harm, our program does not do that. But the reality is, anytime that we are pursuing fitness and we are doing challenging things, which we know to get the best results, there's going to be times where we run into having, a little ache or pain, and it's not the end of the world, and it's something we can manage. That it kind of comes with the territory of really pushing to be the best version of yourself. And so the expectation is, ultimately we become stronger, we become fitter, we do become more resilient to injury, but there's going to be a bump in the road, along the way. Yeah. And that doesn't mean that you stop the car, that you can keep driving, but you just, modify a little bit. And lots of our members experience this on, a daily basis in terms of being able to continue their fitness journey regardless of what the bumps in the road look like.
Yeah, it's so often that people will have old underlying injuries that are never challenged because they just stop.
Yeah.
They just don't exercise because they don't know what to do. They don't have anyone to guide them. So then eventually, like you said, they bump up against some type of barrier or limitation. And typically it's their drive to want to continue to get stronger.
Yeah.
And get more range of motion and continue this journey of having their independence coming back to them. Being able to do things they've not done in a long time, but they're doing things they've not done in a long time or sometimes ever. But a lot of those injuries or limitations are there lying dormant. And sometimes we expose weaknesses or, stiffness. Yeah. And we do our best to always watch form, but that's the way my fitness journey has been too. I've got really stiff shoulders. I have for most of my life. And it wasn't until I started, working on my fitness that I started working on my deficits. And there were days that it was achy or uncomfortable, just little minor stuff. But I've been able to drive and get stronger and get my range of motion better. And we see the same thing with our members.
Yeah.
They overcome those things. This is really interesting, a little bit off topic. But just there was this idea of, I was just thinking about chronic injuries and how they tend to cause limitation over a long period of time. And we talked about having a funeral for an injury. Do you remember that conversation we had?
Dude, yeah.
Where it's for example, I also had a knee injury from a training error when I was, this was 10, 15 years ago. And my belief was so strong that my knee would never be better. It was just baked in my brain. And eventually, as I got stronger and got my mobility back, my knee pain went away. And I've done things I never dreamed I would do, or things for the first time. And psychologically, having a funeral for that injury, putting that injury to rest mentally, you brought that idea to me, and I feel like a lot of people at Stronger Life get to do that.
Oh my gosh.
Put that to rest. I have a bad back. It's oftentimes it's stiff or you need strength. It's not that your back is bad. It just needs more muscular support.
Yeah.
But you've never been given access to that.
Yeah.
Yeah. And it's once they do, they're like, oh my gosh, I've suffered with this thing for decades.
Yeah.
And it's
their life.
You just needed to get stronger. Everyone terrified you to do anything about it.
Yeah.
Sorry, that was a bit of a tangent,
No,
but I think it's important to talk about.
It's related. I think it's related to this question, like for Sue's question. You know, like she's gonna get to the point and she's gonna have a funeral for that foot injury, and it's gonna be a thing of the past. You know?
The thing she wasn't able to do before.
Yeah.
She's gonna have access to again.
Right.
But there's gonna be fear.
Yeah, for sure. And it will not be conquered unless it's challenged, you know.
Yes.
We have lots of examples of this. One that comes to mind is a member that had a lumbar fusion, so their low back was fused, and before they joined, they were in extreme pain, not able to bend over, tying shoes was miserable, just a lot of fear and anxiety related to that back pain, and you really start to lose trust in what your body can do.
Yeah.
And over the course of a couple years, now that person is probably one of the strongest people
in our gym,
in this building that has definitely had a funeral for that surgery. And
put it to rest.
Yeah, I think about that a lot, of like, that's absolutely incredible, and just what that does to the trajectory of that person's life going forward, of what they choose to do, what they can do, is huge. So
it sounds kind of like prepare to move before,
Yep.
move during, and then move after.
And then move after.
Yeah, there's a common thread here, and the research backs that up.
I love it. I love it. All right, Sue, hope you're doing well. Thank you for the question. If you have a question, listener, watcher, wherever you are, you can drop that in our Facebook group. So if you go to Facebook and then go to Fitness for 55 Plus, you'll see our group. You can get in there and drop a question. We appreciate y'all watching these. If you're in the Facebook group, or if you're on YouTube, or you're listening on the podcast, we're grateful for all that. If you found this helpful, we just ask that you'd share it with someone that you think would benefit, particularly someone over 55. There's some younger folks that'll benefit from this message for sure, but yeah, we're grateful for y'all. Thank you for listening, and we will talk to y'all soon. All right.
It was good.
See y'all. Bye-bye.